Hi, everyone. Thank you for meeting so quickly on such short notice today. My name is Mary Ellen Casey, and I am the Director of Quality and Safety here at the hospital. The purpose of our meeting today, just to provide a framework and some background, is to discuss recent events that we've seen here at City General Hospital regarding workplace violence. So, over the past 6 months, we've seen a 40% increase in reported incidents, particularly in the emergency department and the behavioral health unit. So, before we begin, I'd like to ask both of you to introduce yourself, if you would.
Thank you. My name is Catherine. Hello, everybody. I'm the director of the emergency room department.
Hi, good afternoon, everyone. I'm Sandra Fomenko. I'm Director of Security and Safety. I'm in charge of ensuring a safe environment for both staff and patients at the hospital.
Well, thank you both for being here again, as I said, on such short notice. So, we have about 15 minutes to discuss this issue. Not a lot of time, but our goal here is to identify three top priorities to address workplace violence. And just to give you an idea of what's going to be happening on Friday, we will meet with a larger group to begin developing a long-term plan. This is really just to identify our priorities as we see them today. So,
Mhm.
I just want to do a quick review of the case. Oh, I probably should have said that. A quick review of where we are right now. So, to frame our discussion, I'd like to review some of the recent incidents.
Okay.
First, we've had a nurse in the emergency department. She was punched by an intoxicated patient, requiring security intervention. Most unfortunate. Also, a psychiatric technician in the behavioral health unit sustained a concussion after being pushed to the ground by a combative patient. In addition to these two particular incidents, we've had additionally multiple staff members have reported verbal threats and intimidation from patients and family members. Our department has gotten a number of incident reports over the last few weeks describing these altercations. So I'd like to start, Catherine, with you from the emergency department perspective. What stands out to you with these examples?
Well, for what stands out for most for me is the consistency of these incidences. In the ED, we're dealing with high volumes, long wait times, and patients who are often in distress. They could be intoxicated, they can be belligerent, they can act out or confused. In fact, that nurse that was physically assaulted reflects a serious safety concern for my staff. As a nurse, director of the ED and also being a staff member, we're all trying to manage these situations, but we're increasingly overwhelmed, and we're often blindsided by these assaults, and we don't know what to do.
Hmm. Hmm. And
Yeah,
Sandra, how about you?
I can comment on this from a security standpoint. So, from a security standpoint, we have been seeing a very large increase in workplace violence and, security concerns across the hospital. In fact, there's been about a 40% rise in incidents over the past 6 months, which really does indicate a trend. It's not an isolated event, and unfortunately, it is becoming normalized in some areas, especially the ED and in the behavioral health units. Security is responding quickly. My team is responding quickly, but like we've seen, we're often stepping in after violence has already occurred. And this is really highlighting a gap in our approach that we need to work on. We're operating primarily in a reactive rather than a proactive standpoint.
Yeah, it does sound like it's suggesting that we have to shift towards prevention rather than response. Often I see that we're in ED and then the incident has already occurred, and the damage literally is already done. It's a concern.
Mm-hmm. Well, thank you both for your perspectives. You bring up really valid points. So, I wanted to spend a little bit of time talking about the impact. How is this affecting staff?
That's a really valid question. There's definitely a lot of fear and frustration among my staff members. They are reporting extreme emotional distress from day to day. Some of them are, calling out of work more frequently. And then what ends up happening is that the shortage then worsens, and then we're more at risk when that does occur. So it's difficult. It's definitely been a challenge, and I think I'm seeing an undercurrent of PTSD, coming back to work and kind of like, being anxious about what the day is going to bring. So there's a threat of burnout, staff leaving, worsening staff shortages. Yeah, it's been a problematic.
Yeah, we are seeing an increase in incident reports. It's helpful for tracking purposes, but it really is confirming that increased violence is becoming more frequent across the hospital. From a safety perspective, this trend really does increase liability for the organization, and it does raise concerns on if we're doing enough to protect our staff. And it certainly does put an additional strain on security personnel.
Yeah, Sandra, I agree with you as far as the increase in incident reports has been very concerning for our department as well. So this is really impacting not only safety, but also morale, retention, overall hospital operations, and not to mention, part of our department is looking at patient safety in addition to staff safety. So it's certainly a concern from a patient's perspective as far as their safety and well-being and any impact it has on their outcomes. So I want to begin by identifying our priorities. I mentioned at the start of the meeting that our task is to identify three priorities in the short term to bring to a larger group on Friday. So I'd like to ask Sandra, what do you see as the most urgent priority?
So, first priority, hands down, from my perspective, is going to be making sure that we strengthen the immediate safety and security measures. We really need to increase security presence in the high risk areas, such as the emergency department and behavioral health unit. We need to review, along those lines, our rapid response protocols, ensure staff can quickly access help and come up with a plan on how we, can maybe possibly add resources to peak times when it's more likely to see escalation of behaviors and more violent scenarios occurring.
I agree. I think visible security alone can help deter a lot of aggressive behavior. If a patient is starting to act out and they see the security guard nearby, it is a form of de-escalation. And I think the staff will also feel more supported that someone is nearby. I think access is another thing, is that if we close off different areas of the ED, so there's not so many entrances where people can flow so easily, and there is a security person that is by that one main entrance, then that also, again, when the patients come in, they see visible presence. So I think that's a valid point.
True. So we're aligned. I think staff safety is our first priority. So just making a note of that. Um, Catherine, what would you identify as our second priority?
I think it would be staff training and support. I mean, the staff needs consistent training and de-escalation techniques, especially when dealing with an intoxicated, psychiatric, or confused patient. Often they're belligerent, they're acting out, and there's a problem, right? And if they don't have consistent methodology or protocols across the board of what to do, then nurse A doesn't know what nurse B's reaction is going to be and how they can assist. So I think having that, I also think that having debriefings after an incident happens, what could we do differently or better to assure that it doesn't replicate itself? Counseling, again, we talk about that PTSD, and ensuring that staff feels heard, maybe having posters on the walls, identifying that this is a real situation and there's a number that they can call, but there's some assistance. So training and support, I think, would be essential.
Mhm.
Yeah, I agree, Catherine. Training in de-escalation techniques and in, maybe having coordinated response strategies really does help ensure that all staff and security respond in a very coordinated manner and an organized manner. We really need a team effort in approaching this.
Yeah.
Yeah, that coordination is key. I'm just a little concerned, I think, with staffing issues on our end as far as the quality department in coordinating some of this training and debriefing support. That's something that I'll definitely have to look at in terms of our contribution to providing a solution for this problem. So, um, for the third priority, I think we need to look at a systems level contributors. Look at system level contributors, and I just want to get your thoughts on that. Do you think this is something? Are we making it too complicated in our solution, or is this something that needs to be part of the long-term plan?
I absolutely feel that this should be part of the plan in the ED. That long wait times and the overcrowding are just major triggers for the patients that are there. They become frustrated, they become more reactive, and I think if we can resolve that, I think that would be a key, one of the key solutions to trying to damper down the temperament that happens in the ED.
Yeah, I agree with you also, Catherine, on that. You bring up some really good points. I think identifying high risk patients earlier, considering strategies like closer monitoring of these patients, maybe having panic buttons that triage staff can use in the ED or that nurses can use, and separating these patients for de-escalation would be very helpful, when needed.
Yeah, I agree. And from a quality perspective, just thinking about those Press Ganey scores, making
Mhm.
sure that patient satisfaction isn't impacted by what we're experiencing here. So it looks like our third priority is addressing system issues such as patient flow, staffing, and communication. So, in the time we have left, I just want to summarize. This has been a great discussion, and I just want to summarize our top three priorities. What I'm hearing is strengthening immediate safety and security measures, enhancing staff training and support, and addressing systems level issue contributing to workplace violence. Does everyone agree?
Yes, I agree.
I agree as well. I think it's been a good initial discussion, very productive. I think we have a plan in place, and I know that we probably have to, a couple of us have another meeting to go to. When can we reconvene and talk about this?
So we'll bring these priorities to the larger group this Friday at 10 o'clock with the
Okay.
CMO, with our CFO, and start to begin to develop a long-term plan. Before you go, I just want to ask, is there anyone else who should be at this meeting for Friday?
I think I'd like to, and that's a great question, Marianne. I think I'd like to bring the ED doctor, the director, to come in because he
Yeah,
might have a different take on it than from a nursing perspective. So I think that might not be a bad idea.
Yeah,
great.
that's a good suggestion. And I don't know if it would be helpful to have another security team member also come, somebody
Sure.
who's more on the front lines every day to give their perspective.
Great point. Yeah, I think they're invaluable to have some frontline representation. So this is great. So thank you both for your time, and I will
Thank
send
you.
out that invite for our Friday meeting.
Great. Thank
Thank
you
you,
very
Mariella.
much.
Good to see
Thank
you too,
you.
You
Catherine.
too.
Nice seeing everybody. Bye bye.
Bye-bye.
Bye-bye.